Today we will be performing intradermal and subcutaneous injections.
Okay, so this morning we're going to go ahead and start with our intradermal medications, which is the PPD. So this all is going to be taking place in the medroom. So you're going to pull up your order, which would be on the Omnicell in the medroom, and it says that the patient gets PPD, purified protein derivative, 0.1 ml, intradermal, one time only, read it in 48 to 72 hours. So the equipment that I have is my PPD vial, my syringe label, alcohol swab, and my PPD syringe. So I'm going to perform hand hygiene. I'm going to put my gloves on. And I'm going to take my vial. I've assessed it for the expiration date and all of that. I'm going to clean it for 15 seconds. And then I'm going to open my TB syringe, and I'm going to take it out, and I'm going to take the cap off, and I'm going to put the cap in the package that my syringe came in, and I'm going to pull back 0.1 mLs of air, and I'm going to pick up my vial. I'm not going to touch on the top because that's what I just cleaned. I'm going to put my 0.1 mLs of air into the vial, and I'm going to turn it over. And then I'm going to pull back to dose my 0.1 mLs. Now, these TB syringes are very flexible needles, so you have to be very careful that you don't bend the needle while it's in the vial. So by doing that, you just have to make sure you're holding it straight and steady. Now, also, there's lots of little air bubbles that like to occur in these tiny little syringes. So pull back a little more than 0.1, secure it, tap it to chase the air bubbles to the top. Once you've chased the air bubbles to the top, you expel that air, and then you can then dose your 0.1 mLs. And when you're doing that, then you're going to just re-scoop it, re-scoop the cap, put the cap on, and then you're going to put your label on it with the medication and the patient's name and your name. And then you are ready to take this medication to your patient. But before we do that, this patient also needs a few other things this morning. He also needs his insulin pen dosage. So insulin pens look different. Different manufacturers, different organizations have different types. So the insulin pen, you want to have also a label with you, and then an insulin pen needle that attaches. So looking at the order, you see that the patient gets insulin pen at 8 a.m., 4 units, sub-Q, 1 time a day. All right, so I'm going to take this big cap off, and I'm going to take an alcohol swab, and then I'm just going to clean the top of this where I'm going to connect the needle. 15 seconds, I'm going to place that right down beside me, and then I'm going to take and open my needle, and then it just connects and you twist it on. So you just connect it and twist it on. And then I'm going to take this off, and I'm going to place that on my alcohol swab. Then I'm going to turn this to 2 units, and I'm going to prime it, and I see the fluid came out of the tip of the needle. So I primed it, 2 units. Now I want to dose it to my 4 units. Again, I'm double checking with my MAR. So you just turn it to 4, and then we're just going to go ahead and re-scoop this, place it on there gently. I'm going to put a label on it with the patient's name and what kind of medication it is. And then we are ready to go with that. So we're not done yet though, because the patient still needs some more things. All right, the patient also needs his morning insulin. So this is called mixing insulin. There's 2 different kinds of insulin that this patient gets. According to his MAR, he gets a scheduled NPH insulin, 12 units, sub-Q, 1 time a day. So insulin that's NPH is often kind of cloudy. And then he also gets regular insulin, and that's to dose on the sliding scale. So in order to know how many units of regular insulin you're pulling up, you have to know what your patient's blood sugar is. Obviously, before you're giving any insulin, know what your patient's blood sugar is, and not what your patient's blood sugar was 2 hours ago. Make sure that it's a recent blood sugar. All right, so I see that I am drawing up 12 units of NPH, and let's say his blood sugar was 260 this morning. So according to the MAR, the sliding scale, he needs 6 units of regular. So regular is the fast acting, NPH is the long lasting. Make sure you know the difference when you're doing your checkoff, because your instructor will ask you this. So you're gonna pop off the cap if your vial has a cap on it. Again, these are just little dust covers. So you're gonna pop those off. You're gonna take an alcohol swab, and then you're gonna clean it for 15 seconds. Clean it for 15 seconds. And then you're gonna have your insulin syringe. They all look a little bit differently. Opening this syringe, I see that I have a 100 unit syringe. So some of them are 50 units, some of them are 200 units. Just make sure that you know what your syringe is and what each of the hash marks are to tell you how much you're drawing up. So because I need 12 units of NPH and I need 6 units of regular, that means I need a total of 18 units. So before I do anything, I'm going to draw up 18 units of air. Okay. So in order to decrease the amount of times you insert your needle into the rubber stop of the vial, it's good to put the air in cloudy and then the clear, and then you're going to draw up clear and then the cloudy, because you always draw up clear before cloudy. I know it's a little confusing to say it that way, so let me just show you what I'm doing with that. Take the cap off, place it nicely in your little package so it's not rolling around on your table. So I'm going to take my NPH, which before I've done this, I've kind of rolled the NPH because it can be, it needs to be mixed up a little bit gently. So I am ready to inject my 12 units of air into my NPH. So just kind of, you're watching, and I'm injecting 12 units of air. I'm going to take it out. I'm going to pick up my regular insulin, and then I'm going to inject the 6 units of air into my regular. Now, you just leave it in there, because now we're all set to pull it up. So you flip it over. Once again, being very cautious, because these insulin needles are very flexible, very bendy. They're easy to bend. So first of all, since I need to, again, draw up 6 units, I'm going to pull back, and I'm going to see if I have any air. Right now I have about 10 units in here, so I'm just going to insert my needle all the way into the syringe and just kind of tap a little bit to kind of chase the air out. And I'm going to dose it up to 6. And if you dose this correctly and there's no air in it, when you go to pull your NPH out, you won't have any air in it either. So now that I have my 6 units, I have to confirm this. I have to verify this with a second nurse. So Amy, could you come over here and please verify? What I'm doing here is I'm drawing up 6 units of insulin R. According to my MAR, my patient's blood sugar was 260, so he needs 6 units.
6 units, correct.
And I have cleaned this already, so now I'm going to insert this like that, tip it over, and I'm going to draw up my 12. But in my head, I'm thinking I need to pull this back to 18. That's my total dose. So I'm just going to pull it gently back until I get to 18. And then Amy's going to confirm that with me. Okay?
18. And I also confirm your 4 units here.
Yep.
Correct.
Okay, thank you.
You're welcome.
And then I'm going to go ahead and put the cap back on here. Now, one thing that you cannot do is if I'm pulling in my NPH, I can't, if I go over it, I can't insert anything back in there because then I'm putting regular into the NPH. Can't do that. All right, so now I'm gonna put a label on this syringe as well. Okay, so now I have all 3 of my medications that I'm ready to go administer to my patient. So I would go ahead and take my medications. I'm gonna pretend that I'm now in the patient's room. And these are our injection pads. You might not be able to find one like this, but you can do them all on a regular injection pad if you need to. So when you walk into the patient's room, you're gonna, of course, do the normal things that we always do. We're gonna introduce ourselves, ask the patient to tell us their name and date of birth, compare it with their ID bracelet. We're gonna perform hand hygiene, and we're gonna put gloves on. I'm gonna explain to him all these 3 medications that he's getting this morning. The PPD test, which is an intradermal, and that's gonna go in his arm. This is where we have discussed. It's gonna go right here in his forearm. And then we're gonna tell him about the insulin pen, and he knows about the insulin pen because he's always had that. But he's in the hospital, he's had some troubles with his sugars, so that's why he needs a little bit more help with an insulin injection, subcutaneously. So we're gonna explain possible side effects. We're gonna assess the locations that we're giving these. You don't want to continue to give any injection in the same location over and over because that can produce tough skin and the tissue can break down. And of course we want to assess if the patient has any allergies. And we also want to talk about the 6 rights. We want to identify those with your instructor. The right dose, the right route, the right time, the right individual, the right medication, and of course the correct documentation. Because if you didn't document it, it wasn't done. So we want to compare, do our 3rd check when we're in the patient's room. So I would have, if I have computer charting, then I would take my computer, I would pull up the MAR, I would confirm with the MAR, with the patient's bracelet, with my ID badge, and it would say, yep, it's okay, you're good to go. You want to raise their bed to a working height. Always try to provide privacy, cover them with a sheet where you can. We've selected the appropriate site for the injection. It's okay to ask them, where would you like it? Where did you have it last time? And you want to help to support them to a comfortable position. So let's go ahead and do the PPD injection first. So what we want to do with that is we want to basically, you're going to clean the site 15 to 30 seconds, and then you're going to take your cap off and make sure the bevel is up. And you're going to say, okay, Mr. Smith, you're going to feel a little bit of a poke. And so you kind of want to hold the skin taut with your finger, like your forefinger and your thumb. And you're going to insert this at a 5 to 15 degree angle. And you don't have to put the entire needle in their arm. You only want to insert the needle about 3 millimeters. So I've, the area where I've cleaned, I'm not touching that. I'm touching around it so the skin is taut. And at a 5 to 15 degree angle, I'm just going to insert this about 3 millimeters, and then I'm going to let go, and then I'm going to insert the medication slowly, and you'll get a nice little bleb on a real person. Sometimes with these models, it pops out the top, but that wouldn't happen on a real person. You want to observe the bleb, withdraw the needle, and place the needle in the sharps container. So now let's move on to the insulin pen and the insulin syringe. So once again, it's the same things that you're assessing as far as location and things like that. But for subcutaneous medications, you want to give these at a 90 degree angle, and you just want to pinch an inch. So you want to select your site, clean the area off. Again, I have confirmed my checks via the MAR. I have scanned the patient's name badge, I've scanned the medication, and I've scanned my own badge. And so now that the site is dry, I'm gonna take this cap off. And I'm gonna pinch an inch. And show 1, 2, 3, and inject. And with insulin pen, you wanna leave your needle inserted for about 10 seconds before removing, because the medicine can still be coming through the needle. So 10 seconds, hold it in there, and then take the needle out. And again, we never want to recap manually, but with the supplies that we have here at Northwest State Hospital, we don't have any way of getting this off without touching it. So we're going to have you guys just go ahead and scoop it into this big cap right here, and then twist that on, and then if you twist that off, it'll take the needle off. And then you can dispose of this in the sharps container. Okay, so that is the insulin pen. Last but not least, we have the insulin that we dosed up earlier. So again, we know what the patient's blood sugar is. We're doing the third check. We're pulling it up on the MAR in the computer, scanning the bracelet of the patient, scanning the medication,